And here, of course, you have the ECG cable, which you should connect to your patient while doing the CPR process. Here we have the port to connect the cables in which we convey electricity to the patient. So we have two ways of transforming the electricity from the machine to the patient. The first way is through the therapy cable. So this is the therapy cable which will be connected to the pads. Okay, so this is the way, or the preferable way, that we use the or we shock the patient with. The pads is the first way. The second way is the paddles. Okay, for the paddles, if I want to use the paddles, I will just disconnect the therapy cable and then connect the paddles cable. Okay. Okay. So let me tell you about the parameters that you have on this device. So fortunately, you have all of the parameters that you can monitor your patient with. So first, here on top, you have the CO2, okay, which can be very important during to monitor during CPR. So you should be provided with a sample line. I can't find it, but you should ask the biomed to provide it for you. So the sample line would be just connected to the port right here. Okay, and then it will be connected to the patient. If your patient is breathing on a ventilator, which I don't think you would have here. Do you have ventilators here? No.
I don't have.
So if the patient is breathing on ventilator, then you can connect it to a breathing circuit. There's a connection for that. If your patient is breathing on room air, then you can just give them the connection that has like a nasal cannula, which will take the breathing sample and then analyze it in the machine, and then it will give you the waveform as well as the reading. Okay. Below that, you have the SpO2. This is the SpO2 cable, and you should have a prop for that. Below that, you have the non-invasive blood pressure. So this is the non-invasive blood pressure cable. So now it's connected. All you need is the cuff. I'm not sure if you have it there, but when you have the cuff, you just connect it to the cable. Okay? So it's the same connection. You will connect it to the cable, and then you will have your blood pressure reading by just pressing on an IBB. Okay, so if you press on an IBB, the machine will start infusing air through the hose to get the blood pressure result. Below that, you have the ECG cable, so you can get 12 lead ECG with the machine. Okay, you already have here 4 leads by default. I'm not sure where is the connection. Okay, so this is the connection to complete the whole electrodes set. So all you need to do is just connect it to this part right here. Okay, so connect it here, and then you will have the whole ECG leads. Okay, so you can get a 12 lead ECG. Okay. Just remember, to get the 12 lead ECG, you need to enter the patient's gender, age, because also in any 12 lead ECG machine, it would require these information to calculate everything about your patient ECG and give it to you as accurately as possible. Okay. Below that, you have the temperature line. This is the temperature line. If you would like to get the temperature, you will just connect it and then get the probe and connect it to the cable and then to the patient, and you will get your temperature reading. Okay. Okay. So now let's talk about. Well, let me tell you about the batteries first. So the batteries, each battery will go along for approximately 3 hours. Okay, depending on how you use it. Upon me arriving, the machine hasn't been functioning at all, so your batteries now are empty. So it will take a bit of time for them to charge. Here you can see the batteries live on the screen. Okay. Also, you can remove the batteries themselves and just check on them how much life is in them. So this is one of the batteries. You can see it here, and then it would be flashing on how much juice is left in it. Okay. Okay. So now let's talk about the modes that you have on your device. Okay, we have 3 modes on the device. We have AED mode, we have manual mode, and we have pacer mode. Okay, so beginning with AED, AED stands for automated external defibrillator. Okay, that means that it's exactly the same as the AED machines that you see inside the hospitals, in the malls, in the airports. So it's basically intended to be used by non-healthcare professionals, because once you connect the machine to the patient, the machine will do everything. Okay, so the machine is the boss. The machine will analyze the patient ECG, and then the machine will decide if the patient needs a shock or doesn't need a shock. If the patient doesn't need a shock, it will just instruct you to start your CPR. If the patient do need a shock, then the machine will choose the joules, will charge the joules, and all you have to do is just to deliver the joules to the patient. Okay? For the manual mode, it's basically the same. Can we concentrate, guys? So manual mode is basically the same. So but you do everything step by step by yourself. Okay? So you or the SLS instructor or the doctor will analyze the patient ECG, and upon that you will decide, or the doctor will decide, if your patient is having a shockable rhythm or a non-shockable rhythm. If your patient doesn't have a shockable rhythm, then your ACLS instructor will just instruct you to start your compressions. If you do have a shockable rhythm, then the doctor will decide how much joules they want, okay, and then you will charge the joules and then deliver the joules, okay, depending also on what type of shock they want to deliver for the patient. You have synchronized shock and you have an unsynchronized shock, which we will discuss in a bit. Okay. Third and final mode is the pacer mode. So for the pacer mode, we do pacing for the patient's heart rate. Okay, meaning it's basically just like the internal pacemaker that some cardiac patients have, except of course this one is temporarily and it's external, it's not invasive. Okay. Okay. So going back to the 2 ways that we have the ways to convey the electricity to the patient. As we said, we have the pads and we have the paddles, right? So we always prefer to use the pads, okay? So for 3 main reasons. 1, it's much more safe, okay? If you're using the paddles, there are much higher risks of you shocking yourself or someone else, okay, around you. But with having the pads connected to the patient, it's much more minimal risk, okay? The second reason is that through the pads, we can have free hands, right? And during CPR, we try to have as many people as we can for the compressions, for attending to the medications, and so on. So if you put the pads on, you would have free hands. But if you're using the paddles, then you will just lose 1 nurse just to hold the paddles and just give shocks. Okay. Third and final reason is that for the pads, okay, they can work with all the 3 modes. Okay, they will work with AED, manual, synchronized, non-synchronized, pacer, everything. Okay, so you can have advantages of the whole machine. For the paddles, you can only administer or shock for a non-synchronized shock. Okay, so you can only deliver a non-synchronized shock with the paddles. For the pads, you can do anything. Okay. Now let's try something. So we'll start with the AED mode. Okay, so I have put my simulator on normal sinus rhythm. To initiate the AED mode, all I need to do is press analyze. Okay, so if I press the button analyze, it will analyze the patient's ECG, and upon that it will decide if your patient needs a shock or doesn't need a shock. Okay, do we shock at normal sinus rhythm? No. We don't, right? So let's see how the machine reacts to normal sinus rhythm.
Analyzing now. Stand
so
clear.
Stand clear, make sure that you're not touching the patient.
No shock
No shock advised. Start your CPR. Okay, so now supposedly you should start your compressions immediately. Okay, and you can hear the clicking sound. So these clicks are designed so you can perform the most effective compressions that you can give according to AHA guidelines, which is 100 to 120 compressions per minute, and so on.
3,
okay?
2,
and
1.
we'll also guide you through your ventilations. Okay, so by default, the machine is set for an adult patient without an airway, which is 30 compressions versus 2 breaths. If you want to change your patient type, all you need to do is just press on CPR. Okay, so if you press on CPR, you can choose your patient
3,
type,
2,
whether it's an
1.
adult with an
Ventilate.
airway or without an airway, a
Ventilate.
pediatric with an airway or without an airway, because each type has a different ratio between breaths and compressions. So for example, if your patient is a youth with an airway, it's 10 compressions versus 1 instead of 30 versus 2. Okay? If you don't want the metronome to go along with you, you just press on stop metronome, and then the clicking sounds will just stop, and then you can go at your own pace. Okay? Okay. Now let's try something different. So I put the simulator on VF. Okay? And you should all know that during VF we do shock the patient, right? So let's see how the machine do react to VF.
Analyzing now. Stand clear. Shock.
So shock is advised. So the machine have analyzed the patient ECG. It shows joules. How many
Stand
joules did you
clear.
see?
Push shock
200
button.
joules, okay? Because the protocol for VF dosage for adult patients is 200 for the first shock, 300 for the second shock, and 360 for the third and final shock. It's gonna stay 360 after the third shock, fourth shock, fifth shock, whatever shocks that you want to deliver afterwards, it's gonna be 360, okay? 360 is the highest shocks available in any machine, okay? So now we have 200 joules ready to be discharged or delivered to the patient. All I need to do is yell clear, make sure that nobody is touching the patient, and then I deliver with the shock button, okay? So clear, and then shock, and then the shock will be delivered to the patient. Automatically the machine will instruct you to start your CPR, okay? So you will immediately go for the compressions, okay? The cycle will begin counting down from 2 minutes, okay? And automatically, of course, your machine will print you out the ECG that you have shocked upon, the number of shocks, so this is shock number 1, okay? And the joules that you have shocked with. So it's 200 joules, it will also be written that you have delivered 200 joules, okay? Okay, so let's continue with the scenario. So imagine the cycle is done, okay, the 2 minutes are done. So after the 2 minutes are done, the machine will ask you again to press analyze, to reanalyze the patient ECG. Did the patient revert from VF, or still the patient's VF, or did they go to another arrhythmia or whatever? So we will press analyze once again.
Analyzing now. Stand clear.
So stand clear again, make sure that you're not touching the patient.
Shock.
Shock is advised. Can you see how much joules this time?
300.
So it's 300. So the elevation of the joules is automatic in the
Stand
AED.
clear.
Okay,
Push
so 200,
shock
300,
button.
and then 360. Okay. Now, for any reason that I want to change the joules, if I want to lower the joules or make it higher, or even cancel the joules, if I want to modify the joules, I press on energy select, and then I can modify the number of joules. If I want to cancel the whole joules, I'll just press on the trim knob, and then it will disarm the joules. Okay, no more shock.
Push analyze.
Okay, guys. Okay. Now let's try something else with the manual mode. Okay, so this is the AED mode, which we have seen. Press analyze, and the machine will analyze everything, and then it will go along with whatever condition the patient is having, whether the patient is having an unshockable rhythm or a shockable rhythm. Okay. For the manual mode, I will be using the manual menu right here. So energy select, charge, and then deliver in the case of a shock. Okay. So imagine we still have a patient with VF. Your doctor will look at the patient ECG, and then they will decide to shock the patient. They will tell you, please prepare the patient for a shock, then an unsynchronized shock. Then you would prepare the patient. I'm not sure what kind of preparation that you would do, but then you will select the energy. So the doctor order is for, maybe the doctor doesn't want to start with 200, maybe they want to start with 300. Okay, so energy select, you will go for 300, and then charge. So now we have 300 joules ready to be discharged to the patient. I make sure that nobody is touching the patient, and then I shock with the shock button as we did before. So shock. Now the shock is delivered. Okay. So this is how we shock at the manual menu, which you will be using mostly. Okay. and for an unsynchronized shock, which are the most shocks that we deliver for patients. Okay, so all we have to do is just energy select, then charge the energy that we have selected, and then yell clear, make sure that nobody is touching the patient, and then shock with the shock button. Okay, so this is how to deliver a non-synchronized shock. If I want to deliver a synchronized shock, so I have changed the simulator to an arrhythmia that's called atrial fibrillation. So during atrial fibrillation, we do shock the patient. So firstly, we try to treat the patients with medications. If it doesn't work, then they might revert to a shock, a synchronized shock to be precise. So what's the main difference between synchronized and non-synchronized? So for the non-synchronized, I don't really care where the shock is being delivered at the QRS. Okay, it can be delivered at Q, R, S, T, P wave, it doesn't matter. Okay, for the synchronized, as the name suggests, it has to be synchronized. Okay, so the shock needs to be delivered at a certain point at the QRS. That point being is the peak of the R wave. Okay, so we need to deliver the shock at the peak of the R wave. If we deliver the shock, if the patient is requiring a synchronized shock and we deliver the shock anywhere else other than the peak of the R wave, we actually can do more harm to the patient. Okay, you might kill the patient. Okay, so it's very, very important if the patient is requiring a synchronized shock to deliver a synchronized shock at the peak of the R wave. Okay, so how do we deliver a synchronized shock? It's the same as delivering an unsynchronized shock, but with two main differences. Okay, first I press sync. Okay, by pressing sync, the machine will give me one single synchronized shock and then automatically switch back to non-synchronized, because most of the shocks that we deliver are non-synchronized. Okay, so sync, and then I would go with the same step. By just pressing sync, you can see that the machine is having an arrow on the peak of the R wave, right? So it's telling you that, okay, I know where you want me to hit the electricity. Okay, energy select, maybe the doctor wants to start with 150. So go all the way down to 150. Okay, charge. And for the non-synchronized shock, you have seen me, I've just, upon delivering the shock, I just shocked or pressed the shock button and then moved my hand quickly, right? For the synchronized shock, I need to keep pressing and hold the shock button up till it says energy delivered on the screen, and only then I can remove my hand. Okay, this is very important.
That's synchronized.
Okay, so for the non-synchronized, energy select, charge, and then shock. For the synchronized, sync, energy select, charge, keep pressing on the delivery button and hold up till it says energy delivered on the screen. Okay, so why do I hold? As we said, we need to shock at the peak of the R wave, right? And the QRS is an ongoing process, it's a beat. So at this exact moment, maybe the patient is at Q wave, P wave, T wave. So we want to hold the shock button up till the machine detects an R wave for the patient, and then it will shock that the peak of the R wave for the patient. Okay, so it's very important to hold the shock button upon delivering a synchronized shock. Okay. Okay. So now let's talk about the third and final mode, which is the pacer mode. So for the pacer mode, we do pacing, as I said. Mainly we use it to elevate the patient's heart rate in cases of bradycardia. So your patient is having how much?
50.
It should go down all the way to 40, so it's 40 pulsations per minute. Your doctor wants to elevate the patient's heart rate. Okay, so what they do is they will connect, of course, the pads and the ECG electrodes to the patient, and then go to the pacing menu. So pacer, rate, current, and then pose. Okay, so how do we do pacing? Now we select pacer. By selecting pacer, now I can determine or put the option of the pulsations per minute. Okay, so how many pulsations per minute we want to elevate the patient to? Okay, the patient had 40 pulsations. Maybe the doctor wants to have 60 pulsations. So once I select 60, okay, select 60, and then I can select the milliamperes or the current for the patient. So the current is basically It's basically to do the electrical catching or electrical matching, mainly meaning that I need to match the electricity from the machine with the electricity of the heart in a sort of way to add these extra 20 that I want to give to the patient, right? So the doctor should give you how many milliamperes they want, but I'll give you a quick way into determining the milliamperes. So the milliamperes goes between 30 and 90 mainly, okay? So we want to start with 30, keep going up till you can see that the patient's QRS are very clear, okay? So 40, not still yet there, 50, not yet, 55, 60, 65, 70, not yet, 75 maybe, not yet, at 80. Okay, so now we can see that we have a clear QRS, right? So I set the milliamperes at 80, and now my patient is on pacing, okay? The patient is no longer having 40 pulsations per minute, the patient is having 60 pulsations per minute, okay? And we are putting the patient on demand mode. Demand mode is basically, it's like a safety option in the machine. Basically, even if one of the electrodes of the ECG get disconnected, the machine will still give the patient the 20 extra pulsations, okay? If we want to see the underlying ECG of the patient, so this is the paced ECG of the patient, right? So this is the ECG of the patient. This is not the real ECG of the patient. This is the ECG of the patient after pacing. So if I want to see the real or the underlying patient ECG, I keep pressing on pause, and then it will show it to me on the screen for a while, and then will also print it for me, okay?
Instant ECG. Instant ECG.
Okay. So basically, this is the machine. Now I'm going to talk to you about the tests that you need to do to the device. Okay. So we have 3 main tests. Okay. Of course, after inspecting the machine by sight, make sure that everything is working fine. It's not damaged. It's not dirty. I guess you need to clean it as well. So one of the indicators is that here you have the light for the power supply, so it's plugged in. This is in which the batteries are working fine and charging. And this is for the repair. If it's flashing in red, that means that your machine needs to be repaired. You should never use the device when it's flashing red for the repair sign. You should call your biomed to check the device, okay? Okay, so you need to do according to the policy here. You need to do the tests, three tests twice per day, so once per shift. So the first test is the user test. Our machines will do the test at 3 a.m. local time. Okay, that's why sometimes after 3 a.m. you will come and see a paper that is printed. It's also for the old model as well. Okay, so 3 a.m. we should cover the night shift. For the day shift, all you need to do is press options and then user test, and then the test will be printed out within 10 to 15 seconds. Okay? Only use the device if the test says user test passed or succeeded. Okay? Okay. So this is the user test, which will test the device itself. Now we need to test the ways that the device convey or transfer the electricity. Okay? So the first way is the therapy cable. Okay? Okay? So this is how your machine should look like. Your machine should be connected with a therapy cable, and then the therapy cable will be connected to the and then your therapy cable will be connected to the test load. The test load is just a plastic block just to absorb the energy. Okay? So to test the therapy cable, I need to charge at 200 joules. Charge. And then deliver. So how do I know that my therapy cable is working fine? So I know that my machine is working fine because the user test has told me that the machine is working fine, right? Okay, so the therapy cable, I chose 200 joules and shocked 200 joules. So the machine has given me 200 joules and the therapy cable has delivered 200 joules. Okay, if the cable is not working fine, then the joules written on the paper might be lower or higher than 200. It might be leaking or adding joules. Okay, but if it says 200, then my machine and my therapy cable is working fine. Okay, so the therapy cable has delivered 200 joules, which I have chosen on the machine. Okay, so same goes for the paddles. Okay, so for the paddles, it's the same, but we shock at 10 joules. Okay, upon doing the test for the paddles, don't remove the paddles from the machine. Okay, keep them on the machine. I'm just gonna remove them just to show you how to do it. Okay, so first I want to select the energy with the paddles themselves, so I will choose it from the cursor right here, go all the way down to 10. Okay, so this is 10 joules. I charge with the yellow button that says charge. Now, I try to release the energy with one of the paddles. It should not release the energy, and I try to release it with the other. It should not release it alone, okay? It should only release the energy when I press both together. So, okay, so I try to release it with one. It should not release. I try to release it with the other. It should not release. It should only release when I press both together, okay? So it's gonna give me abnormal energy delivery, okay? Because I have just delivered the energy in the air. Otherwise, it should give me 10 joules as I have chosen when they are adhered really well to the machine. Okay. A couple of more things that I need to tell you about the paddles. Okay. As you can see here, the paddles, there's an edge on the back. So when you want to remove the paddles, don't go upward. Okay. Otherwise, you might damage the paddles or the machine. Okay. Instead, do it like this. Okay. So this is the edge, and this is like a roller that will help you to extract the paddles. So when you want to put them back, this is how you do it. If you want to remove them, this is how you do it. Okay, so away from the edge. Okay. One more thing, you should have the pediatric connections for the paddles. I'm not sure where they are. So you should have the connection also for the paddles. It's like a white connection that it would slide in, okay, and then you can. It's not. I don't think it's the same. Can I see? Okay. Yes. So these are for pediatrics. So all you need to do is just slide it in. Okay, now it will work for pedia. Okay, if you want to remove them, go like this and it's out. Okay. Any questions, guys? Do you have pedia patients here or no?
No, I don't know.
Okay, so if maybe I'm not sure. So these are for adults. Okay, the pads, only use them for adults and use pedia pads for pedia. Okay, you can use adult pads for pedia only if you don't have any other option. Okay, any questions? All good? Sure? Yes. I don't know about that. I don't know. No, you have to talk. You have to talk to your it's inside internal thing. So you need to talk to them about it. I'm not sure who supplies you with it. I would be afraid to tell you someone is responsible for it and they are not.
But
So
there's no extra case or two.
there are, of course there are. It's not. You're not gonna.